Hello and welcome. It is truly a pleasure to participate in this conference. Incorporated in 1982, On Our Own is one of the largest and longest standing peer-run networks in the nation, with numerous firsts to its credit, including the first to host a statewide conference in the United States for mental health consumers in 1982, and hosting the first national symposium on stigma and discrimination in 2001. The labors of this organization, its leadership and members are an example of the best of our peer support community that our peer support community can offer to those in recovery and those working to support and assist those in recovery. Given the importance of wellness and recovery centers and connecting people to vibrant communities of peer support to aid in long-term recovery and preventing crises in a manner that acknowledges and engages the self-efficacy of the individual, the Behavioral Health Administration is committed to supporting the expansion and ongoing operations of this service for consumers. We share the goal of having wellness and recovery centers in every community across the state. I am proud to report that that Wellness and Recovery Centers service all 24 jurisdictions of the state, with the exception of 2. As mentioned in the Foundations of Recovery, or what is recovery, according to SAMHSA, there's 4 major dimensions that are on the slide before you. These foundations for recovery are also the foundations for general wellness, and the COVID-19 pandemic has interfered with every area critical for wellness. It has plagued those with behavioral health conditions more than those who did not have behavioral health conditions. It has taken the lives of those with schizophrenia and substance use disorders more than those who did not. It has disrupted the continuation of care for all with chronic health conditions, particularly those who used any type of group-led supports. Physical distancing earlier in the pandemic led to statewide shutdowns, which led to significant unemployment for persons who had entry-level or public-facing, less skilled jobs, the types of jobs many of those in recovery are eligible for, and threatening one's ability to care for themselves and keep a roof over their heads. This disruption in every area of life and watching the carnage of over 9,000 lives lost in the state of Maryland alone has been a significant threat to many people's sense of meaning. We watched more people die of opioid overdoses in Maryland than ever before. Those who died were people some loved. Maybe some of them were even your friends, family members, and possibly even co-workers. If so, I extend my heartfelt sympathies, and I stand with you as someone who has also lost loved ones due to and during the pandemic. I don't think that there has ever been a more collective threat to the sense of purpose than what we are experiencing at this very point in time, and have been over this past 15 months. Those in the helping professions, including peer support specialists, are at a risk of significant effect from the repeated up-close exposure to this collective trauma. Added to all of this, the very communities that we all need to support ourselves through such a challenging time have become disrupted. Until only the past few weeks have we been able to show our physical love and presence to the broader group of those who we call our families, our friends, and our support networks. This pandemic has hit both the haves and the have-nots. However, the have-nots always suffer more, and every statistic continues to bear this out, that minorities in our communities have suffered the brunt of deaths, unemployment, risk to personal health and safety, and all of the consequences of the COVID-19 pandemic, including the behavioral health sequelae. When the pandemic first began, one of the thoughts that I had early on was that while people who had no history of behavioral health problems would have a very difficult time dealing with hardships of the present and what was to come, in some ways, those who had already known what it was like to manage loneliness, grief, fear, separation from loved ones, missing important events, as many of the people I had treated over the years had, that they had a lot to teach everyone else about how to overcome and face hardships and adversity. The pandemic has had a greater negative impact on those in the recovery community. However, I know and believe that just as you have overcome many difficulties in the past, and as a person with an experience of PTSD myself, just as we have overcome challenging experiences in the past, we can do it yet again, and we shall. We will learn, we will adapt, we will grow, and we will help others to do the same. We will do it in community. People who walk in their lived experience, the peer community, you are a beacon of hope and healing that we can all turn to when we struggle to see, to harness, to walk in the resilience that can be found in each one of us. Yet we know that if we continue to build on our strengths together with mutual respect and build on our consumer-driven service system, and to build and continue to build our consumer-driven service system, which is data-driven, we can help improve outcomes and give hope to many. We've come a long way since March 2020, when the first case of COVID was diagnosed in Maryland. And as the threat of the disease continues to diminish, thank God, we continue to strive to put the needs of the behavioral health consumer front and center. I would like to talk with you a little bit about some of our vaccination hesitancy efforts, which is one of our big foci at this time. Earlier in March, we sent out a survey to those who were living in congregate environments to see if clinics were needed to ensure that we can close the gap in treatment access and vaccine access availability for those who have behavioral health conditions, given the complications and the increased risk of complications for those who have behavioral health problems or diagnoses. We have created a dashboard to help us to follow very closely vaccination rates in the state of Maryland for those who are using the public behavioral health system. The last time I accessed this data, which was approximately the end of May, our vaccination rate in the public behavioral health system was approximately 21%. And so we have a long way to go. However, we are definitely making great strides to close the very significant gap that we have. We've also been working to increase access by encouraging provider networks to service vaccination sites, signing up in the Immunet platform, or being a host site for vaccination clinics with pharmacy partners. We have strived to create equity to ensure that providers will be reimbursed for the administration of the vaccine through the public behavioral health system, and have been effective and being able to get the proper coding necessary for providers to be able to collect for providing this service to the public behavioral health system. So very excited about the work that we're doing there, but we continue to be very focused on that, and we appreciate all of the partnership that we have with each of you to help ensure that we are spreading the message of the importance that vaccines are safe and that they are effective and that they are available. We've also been working on enhancing our crisis response service system. As with any system refinement, it is key to ensure that we have the experience of those with lived experience at the table. Your input is critical in helping to identify what works and what does not work. Together, and only together, can we provide a more robust and responsive system. The Crisis System Work Group continues to meet to discuss the development of an integrated, comprehensive behavioral health crisis system with more standardized definitions and models of care, but still unique in meeting jurisdictional needs. And I'm excited about all the hard work that we have done to date. The committees that we have formed to ensure that we are promulgating best practices across the state for all age groups, that we are being led by the data and letting the data help us to determine what the needs are, so that we can be strategic and quickly effective in our approach, and also with a keen eye towards the financial stability and sustainability of any and every endeavor, so that we are not dependent upon grant funding for perpetuity in terms of delivering these services. We have been also looking at how we can shore up the behavioral health provider network and system during the course of the pandemic, and taking advantage of any and all state and federal dollars, including the funding that came from the governor's relief bill, which allocated 8507 providers and substance use disorder residential treatment providers $5 million. Pardon me. So this was only for 507 providers. So $5 million for those providers to help ensure their sustainability, and also $15 million for the support of crisis programs, initially only for mobile crisis and walk-in crisis services. However, we were effectively able to advocate for all crisis service providers to be able to have access to this funding to shore them up during as we continue to move forward, because we obviously realize that this is a very important service and was greatly impacted by the physical distancing that we were all practicing at the height of the pandemics and throughout the pandemic. We have been very focused on behavioral health equity since the summer of 2020, where we started the Behavioral Health Administration started the behavioral health work group on behavioral health equity to address behavioral health disparities and inequities. And we have been going through a very deliberate learning process through the past year in partnership with the Prevention and Health Promotion Administration and many of our community partners. Some of you may have participated in some of the activities that we've had to date, including webinars, symposiums, and conferences to raise awareness about mental health equity and mental health disparities. We're analyzing core elements to examine how social determinants of health should impact our service delivery system. And we are in the process of developing a strategic plan that will help to guide our efforts towards achieving behavioral health equity. And the other thing other big thing that we've done is I am chairing and co-chairing the Racial Disparities in Overdose Task Force in partnership with Dr. Noah Brathwaite. This is a task force that falls under the Lieutenant Governor's Interagency Opioid Overdose Coordinating Council. And our purpose of which is to identify some policy-related solutions towards helping to close the gap and the increased rate of overdose deaths in the Black community, which has continued to escalate over the past several years, particularly since 2017, when the rates were normalizing, though elevated, but normalizing in the white community, but continuing to go up in the Black community. So having some focus work here. Our goal is to have our policy recommendations completed by the summer or August of 2022. So I think those of you, and we do have peers that serve on our task force as well. Thank you for your participation to date, and for those of you who will be coming to work with us on this work in the months to come. I did want to speak to you a little bit about my personal commitment to the work of those who have behavioral health conditions. The picture that I'm sharing with you is a picture that my father sent me a short while ago, and it's one of my favorites, not only because it's a picture of a young me, the little girl in the front on the left-hand side with the ponytails in front of the elderly gentleman, or because it's a picture of my brother who's on the right-hand side, or my younger sister who you might be able to see in the background. This is a favorite picture for part of those reasons, but the biggest reason is because of the man who's in the background of the picture. The man in the background's name, I'll just say his first name is Raymond. And as far as I can remember, he is the first best friend that I ever had. You see, my grandparents provided housing to people who were recovered from severe and persistent mental illness. And Austin, he was a veteran of World War II. He lived with my grandparents probably from before the time I was born until a few years before he died, when I was about 16 years old. The picture taken here is one wherein we were celebrating a special event. And like every special event, Austin was there because he was always there. He was a part of our family. And as odd as that might have been then, and may seem today, this elderly white gentleman who lived with this Black family, he had paranoid schizophrenia, and he was on his medications most of the time. And he was always the funniest and sweetest and friendliest person I knew. He taught me some of my first nursery rhymes and ditties that I still remember, and I remember them as though I was the one who didn't have any teeth. Because Austin didn't have teeth and he didn't like to wear his dentures. And as I grew older, I spent the summers with my grandparents in Charlotte, North Carolina. He would let me sit and read to him for hours, reading the Reader's Digest, learning how to braid his hair, which was different from mine. He never seemed to get tired of this curious little girl who seemed to exhaust her older cousins. He loved me, and I truly loved him. He was one of my many teachers over the years about the value inherent in each one of us. At some point, perhaps when my grandparents moved back to New Jersey, Raymond went to live in a veterans nursing home. And a few short years later, he died. His family, who also lived in New Jersey, were kind enough to invite us to his funeral. I was living in New Jersey, that's where I'm from. And we, and those who knew him as family, this band of young Black boys and girls, my cousins, who were raised in part in his presence, were honored to say our final goodbyes and to thank him for allowing us to be a part of his life. We were blessed to have Austin, and he was blessed to have us, especially my grandparents, who loved him as a member of our family. My commitment to those with severe and persistent mental illness comes out of my love and commitment to Raymond Austin and many others who have shared their recovery journey with me and who have allowed me to help them on their way for the first time or for the 70th time, seventh time. And though I don't always get it right in seeking and listening to the voice of the consumer, I will always continue to keep trying, and I will always value the input, wisdom, direction, and support that I am extended. And so with that, I say thank you very much. I truly appreciate sharing this platform with you and providing some updates with you. I wish you a very wonderful day, and thank you for all of your support and all that you do in helping individuals with behavioral health disorders on their recovery journey. Be blessed.